VinFuture Prize, a new global science and technology prize for humanity from Vietnam. One VinFuture Grand Prize of $3 million. 3 additional special VinFuture prizes valued at $500,000 each. VinFuture Prize honors science and technology work that creates or has a high potential to create meaningful change in the everyday lives of millions of people. Join us to make a change for a better future.
Ladies and gentlemen, a very good afternoon to all of you and welcome to the 2025 VinFuture InnovaConnect, the 3rd event of this year here in the beautiful city, Can Tho. Today's event is a collaborative effort between the VinFuture Foundation and the Can Tho University of Medicine and Pharmacy, marking another milestone and shared mission to connect science for humanity. My name is Đức Vượng, and it is my pleasure to be your host and moderator today. To officially open our event today, may I invite you all to join me in a warm round of applause to celebrate this beginning. Xin một tràng vỗ tay nồng nhiệt để bắt đầu chương trình của chúng ta ngày hôm nay ạ. For those joining us for the first time, a very special welcome. Let me introduce the driving force behind our event today, the VinFuture Foundation. The foundation was established in 2020 with a powerful mission to honor and inspire scientific breakthroughs that create meaningful, positive change in people's lives. At its heart is the prestigious VinFuture Prize, an annual global award celebrating the exceptional researchers and innovators behind discoveries that serve all of humanity. For this special event, we are also very proud to be co-organizing with a true leader in medical education in the Mekong Delta, the Can Tho University of Medicine and Pharmacy. Established over 40 years ago, Can Tho University and Pharmacy has become a primary center for medical training, research, and healthcare for the entire Mekong Delta. With its incredible tradition of excellence for community care, it is a perfect partner to explore the future healthcare with us. Ladies and gentlemen, joining us today are our distinguished representatives and honored guests from both organizations. Representing our co-hosts from Can Tho University of Medicine and Pharmacy, please welcome Professor Dr. Nguyễn Trung Kiên, Rector of the Can Tho University of Medicine and Pharmacy. Joining him is Associate Professor Dr. Nguyễn Văn Lâm, Vice Rector of the Can Tho University of Medicine and Pharmacy. From the VinFuture Foundation, we are delighted to have Dr. Thái Hà Lê, Managing Director. Joining them are 4 distinguished speakers who will bring global perspective and deep expertise to today's discussion. Please welcome Professor Maria Kleczka-Poker from the Louis Bosman Institute for Digital Health and Patient Safety in Austria. Dr. Gernot Gerger from Louis Bosman Institute for Digital Health and Patient Safety in Austria. Dr. Katharina Schmidt from the Danube Private University, Austria. And last but not least, Associate Professor Đỗ Thị Thảo from the Can Tho University of Medicine and Pharmacy, Vietnam. In addition, we are also delighted to welcome leader from the Department of Health of Vĩnh Long, Dr. Hồ Thị Thu Hằng. We are also very delighted to welcome the leaders of the hospital, medical facilities across the Can Tho city, as well as distinguished lecturers, postgraduate students, and healthcare professionals from the Can Tho University of Medicine and Pharmacy. To officially open our event today, we are honored to invite Associate Professor Dr. Nguyễn Văn Lâm, Vice Rector of the Can Tho University of Medicine and Pharmacy, to deliver the opening remarks. Please join me in welcoming Professor Nguyễn Văn Lâm to the stage. Xin một tràng vỗ tay nồng nhiệt.
Good afternoon, distinguished guests and scholars. Good afternoon, everyone. It's a true pleasure for Can Tho University of Medicine and Pharmacy to co-organize VinFuture InnovaConnect, a title integrating technology, ethics, and human factor in the future of healthcare. We welcome on to the third event in the series of this year. As you know, Can Tho University of Medicine and Pharmacy is the only public medical university in the Mekong Delta area and one of the top 4 medical universities in Vietnam. Our mission is to train qualified medical human resources, do research apply, and transfer technology and people's healthcare. We core values responsibility, quality, development, integration. We understand that it even makes the value more realistic. On behalf of board of management, I am totally honored to stand here and deliver opening speech for such a wonderful international conference where imagine scholars, scientists, and healthcare staff exchanging knowledge, intelligence, experience, and creative together. Over today's program, we will hear 4 interesting topics from 4 scholars, take part in discussion, and connect with people all around the world who share your passion. Thank you, Professor Maria Punker, Dr. Geno Jack, Dr. Katharina Smith, and from Australia, and Associate Professor Đỗ Thị Thảo for your engagement today. Thank you, VinFuture Foundation, for your sponsorship and co-organization of this event. I am pleased to declare the opening of the conference and wish you all good health and happiness. Thank you for everyone for making this conference possible. And let's begin make this conference a success. Thank you very much. Thank you.
Thank you so much, Associate Professor Dr. Nguyễn Văn Lâm, for your warm and inspiring words. Now, following those wonderful words from our co-host, we would like to invite Dr. Thái Hà Lê, Managing Director of the VinFuture Foundation, to deliver the welcome speech on behalf of the foundation. Please join me in welcoming Dr. Thái Hà Lê to the stage. Xin một tràng vỗ tay nồng nhiệt chào đón Giám đốc điều hành Quỹ VinFuture.
A very good afternoon to everyone. Dear Dr. Professors Nguyễn Trung Kiên, Rector, Can Tho University of Medicine and Pharmacy, distinguished professor, college, and esteemed guests, it is my great pleasure to welcome all of you to today's VinFuture InnovaConnect event, co-hosted by the VinFuture Foundation and the Can Tho University of Medicine and Pharmacy. I'm truly delighted to see such a vibrant gathering of scientists, healthcare professionals, and students, both here in person and joining us online from around the world. Over the past decade, the global healthcare landscape has undergone a profound transformation. Advances in telehealth, artificial intelligence, and biomedical engineering have redefined how we diagnose, treat, and care for patients. These technologies have brought unprecedented opportunities, from improving accessibility and diagnostic precision to enhancing efficiency and patient outcomes. Yet, they also raise complex questions about ethics, equity, privacy, and human connections in medicine. Today's program, featuring distinguished experts from Australia and Vietnam, reflect our shared commitment to exploring this question through a truly interdisciplinary lens. Together, we will discuss how emerging technologies can be harmonized with ethical principles, legal safeguards, and social understanding to ensure that innovations remain human-centered and patient-focused. At the VinFuture Foundation, our mission is to promote science for humanity. Through initiatives like InnovaConnect, we aim to foster dialogue, collaborations, and the cross-pollinations of ideas between global and Vietnamese researchers. It is through such exchange that science can truly serve humanity, improving lives not only through discovery, but through compassion and responsibility. On behalf of the VinFuture Foundation, I'd like to express our sincere appreciation to the leadership of Can Tho University of Medicine and Pharmacy for your partnership and warm hospitality. Our distinguished speaker, Dr. Maria Hooker, Dr. Gernot Gugger, Dr. Katharina Smith, and Associate Professor Dorothy Thao for sharing your time and expertise, and to all participants for your engagement and curiosity. I wish all of you a productive, thought-provoking, and inspiring discussion, and may today's event open new pathways for collaborations and innovations in building a safer, more ethical, and more human future of healthcare. Thank you very much.
Ladies and gentlemen, and now, before we begin our discussion on integrating technology, ethics, and the human factor in the future of healthcare, let's take a moment to watch a short trailer that gives us a glimpse of today's topic and the inspiring speakers who will share their insight. Thank you very much. Now, it is my great pleasure to introduce our first distinguished speaker, Professor Maria Klechter-Pulker, Director of the Louis Boltzmann Institute for Digital Health and Patient Safety, Austria. Professor Klechter-Pulker will deliver the presentation on the patient safety in the age of telehealth and AI, legal and social aspects. Her talk will explore the EU AI Act, key safeguards for informed consent and accountability, and the human factors that have sustained in virtual care. Please join me in welcoming Professor Maria to the stage.
Thank you very much for the invitation. I'm, as you heard, Maria Klechter-Pulker. I'm a lawyer and specialized also in law ethics and bioethics. A very warm welcome from my side. It's really an honor and pleasure for us to be here. It's been a great experience. It's my first time in Vietnam. And it's really great to see so many young researchers and so many young students, because you will be the future of the Vietnamese healthcare system. And I think it's very important because you're going to change the system to make it better and to make it more safe for the patients and even more safe also for you as working in the healthcare system. So what are we? We are right now a research institute called Ludwig Boltzmann Institute for Digital Health and Patient Safety. It's a research institution, but it's only for 7 years. This is part of the thing in this research program, because the idea is that you can react very fast to just new themes and ideas, and set up this research institute. And after 7 years, it's the idea to go to another university which might not have the possibility to react so fast on new ideas and research programs. And we are very happy that it was able to make a cooperation with the Danube Private University, which will take most of our employees and research studies at the Danube Private University, where we have this cooperation with this university. And we will also hope that you might visit our university in Lower Austria. What is our research topics? We want to improve patient safety. We develop and implement digital solutions that improve patient safety by empowering patients, but also empowering healthcare professionals and supporting decision-making. I'm convinced that only if the environment is also safe from the regulation side, you can make a good job and guarantee patient safety to the patients. Right now, we are about 40 researchers in this digital health and patient safety. And as I said, a lot of these researchers, they will go to the private university. Danube Private University also already changed the university. And there we set up a new research topic, digital health and patient safety. Right now, we have 3 different program lines. The one is the main topic is health professional empowerment with digital tools. So how is the digital transformation of this for the healthcare professionals working with the patients in the hospital in a new environment supported by digital tools? Because it also means a little bit uncertainty for the healthcare professionals, especially for these that are already working right now and have to change the way they are working in future. Our second program line is patient empowerment to increase safety and health literacy with digital tools. As you know, and you heard before, ethics is also very important, but also health literacy is very important. We have to empower the people to use digital tools, to take care of their own body, their own, how they can decide and give the informed consent. So we have also a big research topic on patient empowerment. And the third program line we have right now is designing patient-centered telehealth to increase patient safety. As you will also hear from my colleague, you will see it's very important to have the patients from the beginning of each program inside the project, to have them inside, to talk to them, what are their needs, what are they afraid of, so that you design the digital tools with the patients, but also, of course, with you, the healthcare professionals. These tools have to design in this way that you have to use them very easily in your job, and it really supports you and gives you certainty. I will show 2 or 3 projects we have right now. We have several projects. Some are funded by a European funder, some by national from Austria. Like we have a big project, it's called SmartFox. The idea about this is because we have now in Europe, we have the European Health Data Space. The idea of the European Health Data Space is to use health data from the patients, but not the primary health data. We call it the secondary use of healthcare, because we know these are very important data to make a research all over Europe. So the idea of this SmartFox program is how can we just encourage people, motivate people to make a data donation. And what we are just talking about is either should the law say you have to, can just take your data, or do we want to do it and say the patient can decide if he just gives his data to make research in this European health data space. So this is a very interesting period right now, because each country in Europe has to decide either there will be an informed consent, an opt-in or an opt-out solution about using secondary health data. Another very interesting or main project of our research team is the Austrian Patient Council. Like I said before, it's very important to include the patients from the beginning of each research program, because we can't make medicine without the patients. They have to go the way with us. They have to trust you. They have to give information. They have to be convinced of the way they are going. We call it the patient pathway. So we always have to go with them. So we founded this Austrian Patient Council. Right now, there are about 25 people from all over Austria. You think it's not so many people, but what we have to tell, we are only 9.1 million Austrians, so we don't have so many inhabitants like you have in Vietnam. And we didn't want to make the group too big, because if there are more people, it's not so easy to talk to them and just to exchange all the idea and the interest of the patients. So we now have about 23 patients in this patient council, different age, different gender, different education, and they always help us in very different projects to give us support, to test our tool, to go with us in the implementation process and give us feedback. So it's a body of interesting, committed citizens available for an exchange of perspective at eye level to explore possibilities for improvement in health research issue. What we are very proud of is that the Ministry of Health is very interested in our Austrian Patient Council, because they didn't have one like that before. And they also recognized, like everybody's recognizing now, that's from the ethical and the legal aspects very important to involve patients from the beginning. Another very interesting project is we set up a remote interpreting service in healthcare. Since 20 years ago, I also worked in the Ministry of Health, which was a very interesting experience for me to see also the other side, or to see how do you make regulation to set up a good healthcare system, to make the regulation for the physicians and the other healthcare professionals. And since 20 years, we recognize it's a big problem because a lot of people don't speak the mother language German in Austria. So how can we support them a good healthcare if we cannot even talk to them, if they cannot give their informed consent? Because you have to give your informed consent that we allowed or that you allowed as a healthcare professional to make a treatment on this person. And as we also know, like ICU or which other departments in the hospital, you never know which patient comes in. You never know which language is this patient speaking. So 20 years ago, already there was the idea, we said, why don't we just make the translators over a digital tool so that you can within 2 minutes have the right language here in this medical setting. It took some years to set this up, but since 7, 8 years ago, we just made a big project at the university and set up a remote interpreting services. There are already 300 interpreters inside this service, and the healthcare professional just have to push a button and has the right language in the right time, and the person, professional translator, is interpreting the healthcare setting. We have about 15 languages we usually need in this setting, and these 15 languages you can use within 2 minutes. It was also a very interesting research program for us because we saw this was the first profession who were digital transformed. So because the interpreters that before just were used to work face to face, but now they had to make it digital. And so we were also researching the ethical and also the legal aspects, because the ethical was also very important. They need support. And I think this will also be very important for the healthcare professionals if you're going to work in a digital way, because you're just put in the setting between the patient and you, and then you're just out from with the digital tool and maybe stay alone at home with the history and all what happened. So what we set up a supervision for all these interpreters. We didn't stop with the research, which I now have a study using the interpreting service in pre-anesthesia, because since now all the people before having a surgery, they come to the hospital, they have to wait for hours, and then they give informed consent and have an explanation with the doctor. And we said, it doesn't have to be, they can make it at home and make an appointment. And then also in the advance, they say, I need an interpreter, and which time is the best way to make this talk with the surgery. So also we know it's very important because the people don't have to get off from the work, they just can stay at home and just take the time free for this discussion. So what about the legal aspects of telehealth and AI? We heard about it a little bit before. As we saw, we had to change the regulation for working for the physicians. Especially, we have the Medical Practitioners Act. This is the main law for the physicians, general physicians working in healthcare professional. We also have a special law for dentists. And in former time, the law said the doctors must practice their profession in person and directly. So nobody knew, is it now allowed to use telemedicine, to use digital tools and not be in person in the setting, just face to face to the patient? So the Ministry of Health and the Austrian Parliament just decided to change this regulation to make it clear, to make it safe for the healthcare professionals. So it says now you're allowed to use telemedicine if necessary, in collaboration also with other doctors and representative of other science and professions. We also have new regulations in teleradiology, teletherapy, telerehabilitation, and primary care units. So what are the regulation of telemedicine, using telemedicine? It always says right now you have to inform the patients when you use telemedicine. You have also explain if there is an alternative and the patient can decide if he wants to use it or not. Of course, not if it's the only way, because the patient is far away in another countryside of Austria where there's no hospital near to. But very important is always the ethical aspect and also the legal aspect is the safeguarding of the patient's well-being. So you always have to make the state of the art, how you treat your patient, and using the new technology cannot increase a risk. So using the digital tools have to be as safe as treating the person face to face. So the doctor must be always in control of the situation when even using telemedicine procedures. Right now, we also have a project where we have digital tools, advices, going with the doctors on a helicopter, flying to an accident maybe, or also in emergency cars and see how does it work if not an expert is at the accident, if you're flying somewhere with the helicopter, and then you just ask a specialist in a hospital to say in which hospital has this person who just got accident has to get transferred. Very new, we also heard it in the beginning, is the European Artificial Act, the AA Act from the European Union. As far as I know, it's the first piece of legislation in the world concerning AI and the use of artificial intelligence. Since August 2024, last year, already the first regulation got to be in, how you say, you had to use the AI Act. And within the next months, at least 36 months later, there also have to be the regulation in living for high-risk AI systems. For mainly all the AI uses in healthcare systems are high-risk AI systems. And the European Union also made the regulation, if you use a high-risk AI system, you always have to have the human oversight. That means if you use a high-risk AI system, you always have aim to prevent or minimize the risk to health, and he always has to understand what it is about and has the human oversight. This is a special thing we could talk about for many hours, or maybe the next time if we meet again, because I think it would be possible in the future. Because if one physician is using an AI in a high-risk AI system, you never know how many data are behind this AI system. You don't know how to choose there. Is there any bias? So what I think is the one who is bringing the AI system into the market, into the healthcare system is responsible, and not the one personal doctor or healthcare professional. I think that's not the responsibility as it should be. So we have to think and discuss about this. So this is what the AI Act says. We have different AI risks. The lowest one, there's no regulation about it. And the more it gets with special data or like healthcare, is the high risk, and on the button is where there's an acceptable risk, and this is forbidden to use the AI system. So just to summarize everything, the digitalization, as we heard before, is a very big chance for the healthcare professionals, because I think it can make two things. It can just at a very short time, just support the patient with the right treatment, the treatment state of the art, and make it even maybe less expensive, because you have the times, you can make it just more acceptable and just to use more resources in a short time. But of course, we have to look at the technical support. We have to see if there's an incorrect application. Data protection, of course, is a very high level in the EU. But on the other side, as we saw, the use of second data use, we have to make a balance between the data protection and the use of the patients to set up AI systems and then to help the patient with these new systems. So the challenge is also right now the high implementation costs to making an AI. We need a lot of data. We have a lot of projects. You will also see in the ICU data, we try to make it the European ICU data collection so we can use the data together and help the patients the best we can. But we need to train the staff and patients. My colleague will talk about that. Of course, the risk of misinformation, and at least the protection and personal data. So from an ethical and legal view, I think the data security and the security of the digital tools and the AI, using AI systems, this is the new problem in patient safety. We have to look at from the ethical and legal point to set up in the future also a very safe treatment for the patients, but also for you, a safe working in the healthcare systems. I thank you very much for your attention and wish you a nice day. Thank you.
Thank you, Professor, for your very insightful sharing. Thank you so much again. Yes. And now it is my pleasure to introduce our next distinguished speaker, Dr. Gernot Gerger, Principal Investigator at the Ludwig Boltzmann Institute for Digital Health and Patient Aid, Austria. Today, he was speaking on the psychological aspects of telehealth and AI use in the medicine. Please join me in welcoming Dr. Gerger to the stage.
My name is Gernot Gerger. I'm coming from the Ludwig Boltzmann Institute for Digital Health and Patient Safety. We have an interdisciplinary institute, and I think this is very important when we are talking about these future techniques that are coming to the market, that we will approach these techniques from different perspectives. And my perspective is the perspective of a psychologist. So I'm looking at these topics with the lens of a psychologist. And we heard the legal background already from my colleague, Dr. Maria Kleteczka-Pulka. And you see that in the legal background, at least in the EU, in the European Union, you have this factor, human oversight. So what does this human oversight mean from the technical factor in the background? A human has to check the solutions that are provided by the technical system. Let's start first what opportunities we get from using technical systems like AI systems. And these AI systems will be systems that will come fast, especially to the young users here, the young students, and to the future doctors. So we will have huge systems for decision support systems underpinned by AI. And you will have systems, for example, for automatic documentation when you're documenting your work in the clinics, or when you're documenting work with a background in nursing. And this is an example from Austria. This is a nursing care organization which is using such an AI-supported system. And when you ask the users of the system for using documentations, they're really thrilled and fascinated by it, because they say, okay, when the system is documenting for me, I don't have to write it down on my own. I'm sparing a lot of time, and the information is directly, and they assume also that this is correctly stored in the background. And also this organization says, okay, it really comes with a huge benefit. It saves a lot of time, up to 1 hour a day for documentation. This 1 hour more of working time you can use to interact with your patients or to doing more important stuff than documenting. When you take a look at the international literature, they also report this high amount of time savings when you use automated systems, up to 20 to 30% of documentation time off. This is great. However, we have to, I think, step back a little bit, because when we're using these systems, we have to be sure that the systems are safe from the use. So when you automatically make the documentation, this documentation has to be correct. But there might be a drawback when you're using AI systems. And I guess especially the younger ones of you all using AI systems already, be ChatGPT or something like this. And companies using the systems are very aware of the situation. This is an example from a company which is using AI translations in medical care. It's a company from Sweden, quite cool company. And when you open their main software, they directly say to you, okay, when you're using an AI system, there may be inaccuracies in the system use. So you as a human have to make sure that you have the correct information there. And this is also what the European wants to have as humans. However, let's take a closer look at this. When I, as a doctor, as a nurse, as a physician, must check whether this information is correct, what do I need so that I can check this information efficiently? And when you take a look at the literature, there are 3 different factors that are important here. First of all, if you want to check it, you need to have the time to check it. Second, the motivation. And third, you need to have the necessary skills and competencies that you check whether this information is correct in the background. And I just thought we're simply gonna try this out. I need now the help of all of the audience, so please, everyone, focus on the screen. I will present you a short snippet of an AI documentation. I've made up this documentation, so it's not based on a real thing. I just want to present something here. And please read through this documentation. And after you read through the documentation, I'm gonna ask you 2 questions, okay? So please focus now and read for this short snippet of documentation. To simulate a little bit the time pressure you have in your normal work. Are you finished already? Yes? Almost finished? I take this as finished, just to simulate it in the normal work. Okay. In these documentations, there are errors. How many errors are there in this documentation? Who says there are 4 errors in the documentation? Who thinks there are 4 errors? Simply raise the hand. Who thinks that there is 3 errors? Raise the hand. Who thinks that there's 1 error? Raise the hand. Who thinks that there are 2 errors? Raise the hand. No one is raising the hand, so it's a little bit of 1 or 2 errors. Who is for 2 errors? 1 error? Okay, I just tried it out. Actually, in these documentations, there are 2 different errors hidden. First of all, when you look at the date is in the future. Incorrect. We have the 23rd today. And second of all, there is something in there which doesn't make a lot of sense because it says with no intravenous administration. So there would be 2 different errors or mistakes in the system. And what you have to be aware of when you're using such an AI-generated system, that these errors are somehow quite normal because they come from the technique that you're using it. On the one hand, it is typical for these artificial intelligence systems that they produce so-called hallucinations. Hallucinations are informations that were not there from the beginning. And if you have to check this for the correctness, you would have to spot these hallucinations. Another problem is, especially in the medical science, we use a very specific jargons, and a lot of these AI systems have problems in understanding this jargons. So the literature says they're allowed about 11% error rate. And also what very commonly can happen is that the system is leaving out something like omissions, typical symptoms, or it also can lead to misinterpretations. When you document automatically and when I talk to you, a lot of our speech is contextualized and you have to understand the context to really see what is going on in the speech there. And this is a tough time in the system. And besides this, of course, you also will have still your human error in there. Sometimes we as humans make mistake in the documentation. So this is quite hard to spot. So let's take a look at it. It's like, what do we need as humans so that we can really provide this human oversight to see these correct things? From a psychological perspective, you can think of it in the following way. Basically, when you're checking information for correctness, we have two different brain systems that are working rather independently. On the one hand, you have a fast system 1. This is very fast. It works unconscious. This is a quick check that basically keeps you alive. It's very often used in everyday decisions. That's quite common for us that we are using this system because it's also easy on the brain. However, the downside of the system 1 is with these fast decisions that is quite error prone. To provide you with an example, when I'm crossing here the street in Vietnam, you have a lot of traffic, you have motorcycles, you have bikes, you have trucks, you have pedestrians. And if I take a step over the street and something fast is approaching me, it's important for me to immediately react to it. It's not so important that I correctly characterize, okay, a truck is approaching me or a motorcycle or a car. I simply have to stay back. So there the error is quite fine. It saves me. However, when you have a documentation which has to do correct, this can be problematic. So you should rather use the other cognitive system that is important here, the system 2, which is slower, it's conscious, it's rational, it's used for complex decisions. But let's focus now like how this daily documentation works in your workplaces. And what I expect there is that you will have little time, perhaps also little motivation to really check this for correctness. So in terms of the brain systems that you're using in the background, you might more use the system 1 that is more error prone. And the system 1 might then dominate also this human oversight, and we will use a more error prone system. So that's problematic. We have to change something that work process. And this is also very nicely described in the literature that whenever we have technical information through documentation in medicine or nursing care, we are very willingly to take this information as granted and accept this information. By the way, I think our slides will be shared with you, and whenever something is highlighted, you can follow the links directly to the literature in the background so you can look it up. Second thing, basically what we're doing when we are checking like this information for correctness, we are making a human decision. And the general question is, how do technical systems affect us in our human decisions? And there are really a lot of studies in very different fields, from psychology, from medicine, even from military research. And basically what the system show you is that when you have feedback by a technical system, you adopt your decision in favor of the technical system. So in this study, for example, it was compared when you receive feedbacks by an AI system compared to real human feedback, and nearly all persons adopted the decision in the direction of the technical suggestion. So we have to be aware that these technical solutions, decision support in sense, will influence our decisions, and very often they influence decision that we adjust our decision in the direction of the technical system. This is called automation bias, and it's a very robust and strong bias in human decision making. Let's take a look at the last aspect. I said, if you want to check the systems for correctness, you need to have time, motivation, and the last one is skills and competencies. Can these technical systems be used to increase our competencies? How do they affect our competencies? Or do the technical systems even decrease our competencies? And this is also a very nice study conducted in Austria in the General Hospital, where they had a technical AI system which was trained to recognize different forms of skin cancer. And when you are a doctor in a training in the beginning, this distinction is quite hard to say, this is skin cancer, this is not skin cancer. And what they did in this research is they supported every doctor, be it young or at higher levels of expertise, with these technical recommendations from the technical systems. And what they found is that there was really an improvement, especially for younger doctors who have little experience and at the same time also a high trust in the technical level. They really learned from the systems to getting better in recognition of skin cancer. However, there is a downside. Doctors who are more experienced already with a high experience, they didn't profit at all from these recommendations. And even more important, if these recommendations do not have a high reliability, all groups get worse. And this is very typical sometimes in the medical sciences. Sometimes the decision is not so spot on. You have many different possibilities when you're thinking about diagnostics. So when you have this high level of unsecurity, and this is also reflected then in the technical system, because we just have to be this level, then everyone gets worse. Even the experts get worse in their ratings. As a last point, I just want to take a step back, because currently, when you take a look through the media, you always read like, okay, this AI revolution, this technical revolution of artificial intelligence, this is something that never happened before. I'm not so sure about that. We had a lot of technical revolutions in our life. This makes us humans. We develop techniques so we can navigate more efficiently through the world. And what is important here to see is like with similar technical revolutions, how did the similar technical revolutions affect your skills and competencies, for example, when you automate something? And there's a very nice example here. I just flew over from Austria, quite a long flight. Basically, when you're nowadays entering an aeroplane, these flights are very safe. In the background, the flight is 90% of the time flown automated by computer decisions. And this is completely fine because it works good, the system. However, what happens to the skills and competencies of the pilots who are using the systems? And there the research very clearly shows when you're constantly using these automated systems, you're losing your skills and competencies again. So pilots are usually, they are highly trained, then they begin to fly automated all of the time, and you see that the skills and competencies decrease over time. So that's why in the airplane industry, for example, pilots are enforced to fly without autopilot during flight so that they keep in training. And we have to remember this for our systems as well if we want to generate patient-safe systems. So what you can see when you lose a lot of this tech is that your existing skills can decrease and you're hardly learning any new skills. And on top of that also, when you rely too much on these technical suggestions and proposals, you also see that this is linked to a reduction in critical thinking, and critical thinking is quite important in your professions over here. And this is also tied to how much trust you put in the systems. This is especially high in those persons who trust a lot in these technical systems. So when we want to implement automated AI documentation or decision support systems in medicines, we really have to think about these factors during implementation, because only in this way we can provide patient-safe implementation. And there is a recent paper, 2025, out with very nicely summarizes these different aspects that you have to consider when you want to implement a new technical system. First of all, clinical accuracy. This is the part that I've been now talking about, and the psychological background that is linked to the clinical accuracy. Then you also have to consider the legal backgrounds, which Maria was talking about. patient privacy and legal liability. And then you also have to check the transparency in these AI systems. We are normally not able to understand of how the machine comes to the conclusion. So we have to think of systems that explain us somehow how this machine in the background is working, and also interprofessional communication. And with this, I want to close. And if you have open questions, please feel free to ask me now or afterwards. Thank you very much.
Thank you so much, Professor Dr. Gerger, for the very insightful presentation. And now it's my honor to welcome Associate Professor Tho Thao, Vice Dean of the Faculty of Odontostomatology at the Can Tho University of Medicine and Pharmacy. Please join me in welcoming Associate Professor Tho Thao to the stage. Today, she will deliver a presentation titled Reaching Dentistry and Biomedical Engineering Innovation for the Future of Oral Healthcare. Xin một tràng vỗ tay nồng nhiệt dành cho diễn giả của chúng ta.
Good afternoon, everyone. I am Dr. Tho Thao from Can Tho University of Medicine and Pharmacy. Today is a great honor for me to have a presentation at this conference. And today, my presentation about the bringing dentistry and biomedical engineering innovation for the future in oral healthcare. Actually, because I am a dentist, so I practice every day in the clinical cases. And recently, we also have to do research, and the topic for the conference today related to AI and the patient safety and biochemical engineering. So that's why I want to present this topic today. And this is the outline of my presentation into two parts. The first is the common dental problem. The second is biomedical engineering application in dentistry. So I am a dentist, so every day we contact with many patients with many problems in dentistry, with the oral and maxillar disease, for example, dental caries, periodontal disease, malocclusion, tooth loss, and cancer, and another problem related to in the oral facial area. So as a dentist, this is our role is very important to have the diagnosis and give a treatment plan for the patient, and we need to give the management therapy for the patient. So with the development of biomedical engineering recently, they have many information and technique can improve the diagnosis and treatment plan and management in many diseases in dentistry. So we know biomedical engineering contribute to the dentistry through the development of advanced material, diagnostic tool, and regenerative therapy, and many therapy. And the first problem in dentistry I want to show you is the dental caries. We know dental caries is the disease from the bacteria and can develop from the early or moderate or the severe. And as a dentist, we need to know how to prevent and how to control for the patient and have the good management for the patient. With the biomedical engineering recently, we can apply in different way. The first is we can give the diagnosis technology. The second, we can have the minimum invasive regenerative treatment. And the important, how can manage the dental caries? We know that then now there are many material we can solve with the decay or dental caries for the patient. And a second problem is the tooth loss. We know that the tooth loss is the result with the periodontal disease, dental caries, or the trauma, and many factors. And recently, we need to have many therapy to replace the missing teeth, depend on just individual tooth loss, full mouth tooth loss. So recently, there are different types of prostheses. It can be removable or the fixed. And you know, the famous the new technology recently in the dentistry, we need to use the implant with the prosthesis. And you can see this is the one picture of the patient. See how the full mouth toothbrush, and how can we do the denture for the patient. And after they have the denture, they feel more confident, they're more happy, and they feel easy for chewing and speaking. So this is the role of a dentist. We need to know how to improve the tooth loss of the patient. And the first therapy or the first method we can use is removable prosthesis, complete denture for the patient. In traditional method, we need to use many procedures, many steps to finish the complete denture for the patient. For example, we need to do the first impression, second impression, and we need to have the good connection with the lab. And we need to use many material to do the removable denture. But recently, when development of biomedical engineering, they contribute many techniques and methods. For example, CAD/CAM, 3D printing, or AI, and many advanced biomaterial, and especially imaging that we can apply to do removable denture for the patient. So with the biomedical engineering development, we can do the denture for the patient with simple project, and we can use the intraoral scanner, and we can design with the program and a new advanced material. So this is the procedure, how can do with the digital technology or AI to do the denture full denture for the program for the patient with the advance of biomedical engineering. And this is some type of the fixed prosthesis. Depend on what kind of teeth that the patient have the problem, we can do the round or the bridge or the implant. For the implant, this is the new technique that we use in the patient with the tooth loss. And recently, with the development of biomedical engineering, we can use the convexity scan to evaluate the bone quality and quantity before we do the treatment length for the implant. And another way, with the implant planning software, we can provide the surgery virtual planning to do the digital accurate and predictable before we do the treatment for the patient. And for another software, we can decide how to do the denture for the patient after the setup the implant. Another problem in the patient that is malocclusion. What is the malocclusion? Malocclusion means that the misalignment of the tooth in one jaw, upper or the lower, or the misalignment between the upper or the lower jaw. So when the patient have the malocclusion, they have many problems with speaking, or they feel speaking or chewing and breathing, and sometimes they don't feel confident when communicate with other people, so reduce the quality of life. So this is the example of the patient how before and after the orthodontic to improve the malocclusion condition. So in traditional, the orthodontic procedure for the patient is quite long and very complicated with many steps. But recently, with the development of biomedical engineering, we can use many different techniques for imaging, or scanning, or printing, AI, and we can set up the orthodontic more simple and new technique can use. So in the material for the orthodontic, we can the braces. We have many different kind of braces, from the metal or ceramic or cell ligating or lingual brace.
But recently, with the development of biomedical engineering with the digital technology, we can use the virtual planning software to create the treatment plan for the patient. You can see in the video. This is the way we design the clear aligner for the patient. And the last part of my presentation is recently with the development of biomedical engineering, with many problems in the oral cavity, the new equipment and material we can do for the treatment or diagnosis of oral disease is biosensor. So this is a new method that we can use to the diagnosis or the management of oral disease. So oral biosensors is a device to use they evaluate the biology and chemical in the oral cavity to detect the disease. And this is the procedure principle for the biosensor. And recently, in our cavity, we have the saliva. This is the important marker that we use to evaluate for the diagnosis, for the treatment and management of oral disease. And from the saliva, we can use the biosensor to detect the DNA, protein, or RNA, or metabolic. And another component in the oral cavity, we can use the gingival fluids, gingival vesicle fluids. And recently, with the biosensor, we can apply to investigate and diagnosis with different conditions in the oral cavity, such as oral cancer or periodontitis or dental caries, and we can use in the implant. And one important mission when we can apply with the biosensor, that's we can use the sensor for the treatment. In previous slide, I introduced the important role of the biosensor in the diagnosis of oral disease. And in this slide, I would like to introduce about the role in management or the treatment, contribution for the treatment of the intraoral sensor inside. They can improve for the orthodontic or they can improve for the prosthodontic and can to improve some the quality of treatment. So this is the summary for my presentation that with the biochemical engineering with the different problem in the oral cavity, we can apply to diagnosis or do the treatment plan or the management of other oral diseases. And this is the summary of my presentation. Biochemical engineering play a vital role in the dental diagnosis to do the treatment plan and therapy and enhance the diagnostic accuracy, improve the treatment quality, maintain the inseparable connection with the modern dentistry. So I would like to thank VinFuture Foundation give me opportunity to have a presentation today, and I would like to thank my university support me and our activity to organize this event and invite professor come here, and would like to my colleague to support me some picture and idea and my student. Thank you very much for your presentation, listening today. Thank you.
Thank you so much, Associate Professor Đỗ Thị Thảo, for such a fascinating perspectives. And now we turn to our final speaker, Dr. Katharina Schmidt, core team scientist at the Laboratory for Life Sciences and Technology from Danube Private University, Austria. Today, she will present a topic on plasmonic single molecule biosensors, highlighting how confocal DEF imaging and smart surface chemistry are unlocking early disease detection with exceptional sensitivity. Please join me in welcoming Dr. Katharina Schmidt to the stage. Xin một tràng vỗ tay dành cho diễn giả Katharina Schmidt của chúng ta.
So thank you very much for inviting me. It's an honor to be here and to give a presentation. I welcome you from my side to talk about plasmonic single molecule biosensors. My name is Katharina Schmidt, and I'm coming from the Danube Private University in Austria. So this is a quite young university focusing on dentistry and human medicine for now, but will expand to also psychology in the future. So we have two main research areas for now, which I want to shortly introduce to you. So one is the medical image analysis with artificial intelligence. And the second one is the LIST life science technology, where I am a part of. So we develop biosensors, and there are two main subgroups in the LIST group. One is focusing more on electrochemical biosensors, and I'm part of the group who does optical biosensors. So this is the optical biosensors technology group at the DPU. And the team leader of this group is Jakob Dostalek. There are three main core scientists within the group. So there is my colleague, Can Tho. He focuses more on optical sensing systems engineering. And then there is Juan Alegreto. He's focusing on functional materials for sensor development. And then there is me. I focus on bioanalytical sensing and applications. So we three have complementary skills, and we closely work together. So the main focus of our group is to develop biosensors for disease diagnostics. So what are biosensors? So it starts with sample collection, which can come from sweat, tears, saliva, urine, breath, or blood. These samples are collected and they contain certain biomolecules which can tell something about the health status or the disease of a person. So this is then used to be analyzed by our biosensors technology. The core element of this is the sensor surface, because this is in contact with the sensor. So it has a dual functionality. On the one hand, it needs to be anti-fouling, so it has to prevent the sticking of biomolecules that we don't want to analyze. And on the other hand, it has to show selective functionality. So in order to bind only the molecule which is of interest. Combining this with a light source and a signal processing element, data can be displayed. And that means data that shows that certain molecules are immobilized on the sensor surface. So my research is mainly to develop biosensors for early cancer diagnostics. Why is this important? So the World Health Organization stated already that one of the most leading causes of death is cancer. Alone in 2022, there were around 10 million cases of death reported coming from cancer. The most common cancer types are lung, breast, colorectal, and prostate cancer. So the United Nations then implemented this in one of their Sustainable Development Goals, in the goal number 3, well-being and health. So the goal is to reduce the number of premature deaths caused by non-communicable diseases, which include cancer, by 33% until 2030. And the main way to do that should be through prevention and treatment. And we believe that biosensors can be a key element in this process because it can enable early diagnosis. And the earlier cancer is diagnosed, the faster the treatment can be started and the better the chances of survival are. So that's why we introduced an ultrasensitive biosensors technique that is based on an optical and enzymatic enhancement technique. So there are already various diagnostic methods in place for diagnosing cancer, and usually they are also used in combination. There are, for example, imaging techniques like X-ray, CT scans, MRI, and so on. And they come with certain drawbacks like radiation exposure risk, then instrumentation come at a high cost, and they're still having limited sensitivity. Then there is the commonly used biopsy to examine tissue samples. However, this is a very invasive procedure, and there is a potential for human error. There are also already some laboratory tests in place for testing blood, urine, or doing some genetic testing. And this is, however, still a limit of specificity, and also more advanced tests come at a higher cost. Then there's also endoscopy, which also is an invasive procedure, and there's a risk of infection. Therefore, we introduce a new approach for diagnosis, which should be started from just simply drawing a blood sample from the patient, because the tumor in the body, it releases certain biomolecules like proteins or nucleic acid like DNA into the bloodstream. But the number of these molecules, if the cancer is in very early stage, is very low. So it's quite diluted in the blood. So that's why we need a very sensitive technique to be able to detect those molecules. We can just let the blood sample be analyzed by the biosensor, and by this dual optical and enzymatic enhancement, we have the great sensitivity, and the overall goal is then to visualize single molecules. So the advantage of this method is that it's non-invasive, it has it's very versatile, has high sensitivity, and it's rapid. So again, the goal is to detect molecular biomarkers by combining optical readout strategy that is based on fluorescence and an enzymatic amplification technique to go from surface averaged signal output readouts to detect the signal of individual molecules and visualize them. So the enzymatic amplification I keep on talking about is called the rolling circle amplification. It's an isothermal technique, which is a great alternative to the well-known polymerase chain reaction. It is based on a circular DNA probe that is called the padlock probe. We designed it to have three distinctive sequences. There is the ligation targeted sequence for making the DNA circular. Then there is the capture sequence for hybridizing the complementary primer sequence. And upon addition of polymerase and nucleotides, the RSA is then started. And this primer sequence is extended by the polymerase by rolling the padlock probe over and over again and reading out the sequence. So in the end, it produces a long single-stranded DNA strand with the repetitive complementary sequence of the padlock probe. And finally, there is the labeling sequence, which can then be used for attaching complementary sequence labeling strands to tag them, for example, with fluorophores. So the optical technique that we mainly use is called plasmon-enhanced fluorescence. It is based on coupling light to the surface of metallic nanostructures. It produces a confined surface plasmon field. And when you place a fluorophore within this confined surface plasmon field, the fluorescence is enhanced. So this is easily be implemented in bioassays by just tagging proteins with fluorophores. And then the assay is performed on the sensor surface, and that's how you can bring the fluorophore within this strong surface plasmon field for strong fluorescence. So this is implemented in a home-built setup that is schematically drawn on the right side of the slide. You can see there is a laser that enters from the backside into the prism, which is serving as a coupling mechanism. And then at a certain angle, it is totally internally refracted, going to the detector. In this way, at a certain angle called the resonance angle, surface plasmons are produced that penetrate into the electricum of the other side of the slide. On this side, a flow cell is clamped where a peristaltic pump can pump sample solution in and out. The fluorescence is then collected from the front side, and that is done with a photomultiplier and counter for surface averaged output. So it collects the fluorescence of the whole surface. And this can then be replaced for single molecule imaging by EMCC D camera to take an image of the sensor surface. The bioassay that is implemented in this case is depicted on the left side of the slide. So we have on the sensor surface first the antifouling layer, and introduce then the functionality with a capture antibody that is specific to the analyte. Then there is a secondary antibody that is that can bind to another side of the analyte, and this one is tagged with the primer sequence of the RCA. So it can selectively bind to the padlock probe, and the RCA can be initiated. So a long single-stranded strand is produced on top of this immunosandwich assay. And then this can be also labeled with fluorophores for the fluorescence detection. So in this sensorgram, you can see the output for the surface averaged signal. On the left axis, there is the SPR response plotted. So if there's an increase in the SPR response, it means there is attachment of biomolecules to the surface. You can see plotted in red color, this is the signal for the specific detection. So in this case, it targets the analyte interleukin 6. And in black, you have the control experiment where there is no analyte used. You can see around 150 minutes that the RCA is started, and only in the red signal you see a huge increase in the signal, signifying that this is a specific amplification. And then after 60 minutes, the amplification is terminated, and DNA is labeled with fluorophores, which you can then see in the graphs below, where the fluorescent signal is huge only for the specific assay with the interleukin 6. So what advantage does this system have? So I did some calibration curve with the commonly used direct immunosandwich assay, where the detection antibody is directly labeled with fluorophore. So this is plotted in black. And then compared to the blue curve, which shows the calibration where the analyte concentration was changed for the immunoassay, combined immunoassay approach. So you can see the curve shifts to lower analyte concentrations, and limit of detection, which is a quantity of sensitivity, can be estimated. So for the direct labeling, it is around two times higher than for the immunoassay approach. So it is improved. However, the bottleneck in this experiments are that the background is also increased, which needs to be addressed in several steps to finally achieve single molecule imaging. So in this case, we developed a 4-channel microfluidic system to have to perform 4 experiments parallelly at the same time. Then afterwards, the sensor surface is imaged with a confocal fluorescence microscope. Here you can see the images on the right side of the slide. So in higher analyte concentrations, you can see it's more like a bright fluorescence ensemble, while when diluting the analyte concentrations to lower femtomolar range, the spots become well separated, and each spot is associated with one single molecule. So this can then be further implemented into a digital readout system by plotting the histograms and determining a certain threshold. Above this threshold, all the number of spots are counted and used for calibration. Like this, limit of detection could be determined in the around 4 femtomolar, which is already quite good, and in this range where we need this very sensitive range. So this is more experimental data. It's just to show you that it's also possible by implementing the plasma-enhanced fluorescence imaging to monitor the kinetics of the fluorescence during the RCA amplification of single molecules. So you can see in the plot, for each molecule plotted the fluorescence over the 60 minutes of RCA time. And this reveals very interesting features. So which in the surface averaged output or with the confocal fluorescence microscope, we would not see. You can see that they don't just appear all at the same time, rather in the whole duration, starting maybe at around 10 minutes. And also there is a fluorescence fluctuation within this amplification time. So this is something we're still investigating. So this was all great and nice, but this was all performed mainly in buffer. So the main challenge is to analyze now real samples. And this can be approached by looking at the biointerface. So at the biointerface, you have to consider on the sensor surface all the charges that are involved. And that's why we used a better, like a newer generation of surface engineering called the polymer brushes. So usually the biodenulated self-assembled monolayer, short biotin SEM, is used, and we compared it with the with polymer brushes, which are more a three-dimensional network. And with this, and considering all the charges involved, it was possible to detect specifically the interleukin 6 in standard serum samples. And you can see for both biointerfaces, it is possible. However, for the polymer brushes, the experiments are more reliable. With this, I would like to conclude my talk. I showed you that the immuno-RCA approach works very nice for plasmonic biosensors. Then it is possible to achieve a single molecule detection also by implementing a digital readout format. It is possible to do real-time plasma-enhanced fluorescence imaging for single molecules and to detect disease-relevant biomarkers in bodily fluids. With this, I would like to conclude my talk, and thank you very much for your attention.
Thank you, Dr. Sunish, for a very insightful presentation. Ladies and gentlemen, now we are moving to the final part of our program today. We are moving to the Q&A session, the most interactive part of today's program. For our online audience, please feel free to submit your questions in the chat box, and we will direct them to the most suitable speaker. For those of you who are joining us here today, simply raise your hand and we'll bring a microphone to you so you can ask your questions directly. To begin, may I invite all the speakers back to the stage, and we will join the audience here. Please welcome back to the stage Dr. Gernot Gerger, Professor Maria Kletka-Pulker, Dr. Katharina Schmidt, Associate Professor Dorothy Tao. Ladies and gentlemen, while we're waiting for our students here to ask the questions here, I also have received a lot of questions from the Zoom, who are the Zoom audience who are currently joining online this session. So they have a lot of questions for our distinguished speakers today. So I have the very first question for the distinguished Professor Maria Kletka-Pulker. The question is about when an AI makes a wrong decision that has serious consequences for a patient, whose ultimate responsibility is it? The programmer, the company that owns it, or the doctor himself?
Thanks a lot for the question. Right now, I think we have to discuss this very strongly because the AI Act says at last the human being is responsible if he just takes the AI under his consideration to make a decision. I think we have to change this. It's like, because like when you have a project and you make a production or you just build a car, the one who's building your car is responsible for it. So I think we have to change it. That is responsible, the one who is making the AI put into the market, or maybe the hospital is using that AI, but I think it's not possible that the single doctor, the single dentist is responsible for a wrong decision.
Thank you so much for your answer. So we are having a student who also has a lot of questions for us today. Em có thể giới thiệu bản thân với các diễn giả bằng tiếng Anh.
Okay, hello, I'm Thu I'm currently studying dentistry in Can Tho University of Medicine and Pharmacy. I would have a questions for you guys. We would like to know that about the telehealth in Austria. Every hospital in Austria have this system, and the patients can have access for it, right?
Okay, I hope I understood it right. The question was if telehealth is in every hospital already now. Not really. We have a lot of projects right now to implement telemedicine, but it's going very slow. It's because of the data protection. Every hospital has a different IT system, and there's not a general system for the whole Austria. Even the hospital, even the physicians working alone, and even the nursery homes, they have a different IT system, so it makes it very complicated, and we're still working on that.
Yes, thank you for your answer. And today here we are having 3 representatives from Austria. So may I kindly ask this question also for Dr. Gernot Gerl. Could you please also answer this question to our audience?
About telehealth in Austria. I just can add to what Dr. Maria Kletka-Pulker said. In Austria, a lot of it is in the stage of pilots, but nothing is like implemented in the normal treatment system yet. We have a lot of obstacles to overcome. On the one side, the legal obstacles, but on the other hand, also like practical obstacles in how to implement all these solutions in a patient-safe way.
Yes, thank you so much. And I think our audience also would be very happy to also hear the perspective from Dr. Katharina Schmidt also about this engaging information.
I mean, I'm not an expert in this area, but I believe my colleagues, and a lot of things are usually stopped in Austria because, yeah, it's very bureaucratic and slow. So.
Yes, thank you so much. And we are also having some questions online also for Dr. Katharina Schmidt. The question is, new medical technologies may help reduce the workload on healthcare workers, but it will cost doctors clinical skills and intuition to erode over time. What do you think about this issue?
So the question is that it will have a lot of work for the labs, right?
Yes.
Okay, so this is what I presented. Yes, it's performed in the lab and you need skilled people to perform that, but the overall goal is to develop a point of care biosensor so that can be preferably used by the patient themselves. So it should be very easy to use.
Thank you so much. And from our audience here today, is there any question from you? Oh, I also see another student. Could you please introduce yourself to our speakers here?
So, hello, my name is Ha. I'm currently a dentistry student. So, I have a question that is how much the patient need to pay for the telehealth?
Professor Maria Kletka could answer.
We have a social system in Austria, so everybody is insured, mainly everybody. And usually the insurance takes the costs over for the treatment, also for telemedicine. But as we said before, there's not really so many telemedicine already implemented in Austria. But also in the project, it's financed by the government. But beside, we also have a private system. If person, they have the social insurance and also a private insurance, and they can choose either they use the public one or the private one. And in the private sector, there are already some, I think, more telemedicine use and digital use, and usually the patient just pay them by themselves by the private insurance.
So I just want to add, this is a very nice example where the implementation goes slower as expected, because in the end, currently also in Austria, it is not clear who will pay for it. It should be the normal social system, but we don't have fixed contract sets. And this can also hold like these innovation processes in the background.
Thank you so much. We are having another question from a distinguished guest today. Thank you so much. And could you please introduce yourself so that our speaker can know you better?
Hello, everyone. My name is Can Tho. I am currently Vice Director, Can Tho University and University Hospital. And I very appreciate all of them. All of you have an amazing presentation. In the presentation of Dr. Maria, you mentioned about 2 points that I very interested. The first one is the smartphone. I wonder that if we create a citizen-based data donation for the research, clinical research, how can we control the quality and the security that we can use the data for the clinical trial research? The second question is about the telemedicine. You mentioned that in the future, that means the further adoption, you will enhance the teleradiology, teletherapy, telerehab, and you can carry out in primary care unit. I wonder that in one country, that means you have the same or the unique system for the telemedicine. But in the case of, that means in the Vietnam setting, we have a lot of system. And it is hardly for us to contact stably with the community. And in these cases, how can we get the money from the insurance system for that activity? Because I believe that it is one of activity with a meaningful, how can I say? That means we must carry out this activity, but sometimes we must get some benefit from that, especially from the insurance system. Thank you.
I think this question is specifically for you, Professor. So, yes.
Sorry. Okay, thank you. Yes, thanks a lot for the interesting question. The first one is, how can we be assured of the quality of the data? I think this is a very important point, because we have so many data, but they are all in different quality, in different kind of how they exist. And this is now the big work we have, just to make to evaluate the data, that they are safe, the data, that they are right, the data, that they're in the right way, just to combine them all. I think this is right now we have big work to do. And in future times, they now try to make more registers and just make legal regulations that we have from the beginning the right data in the right way we have, as you said. And also if we involve patient, it's also very interesting or very challenges if they use, for example, some app like health apps or something. How can we use this data and how is this data really a good data and is it right? So this is all a challenge we are also researching right now. And the other question, like you asked, this is also a big project right now because we also have 9 regions in Austria. And financing is also different in the hospitalized primary care. Right now, they are also trying to, they took some, the telemedicine or telerehab, so the insurance is now testing which could be criteria to make some telemedicine use to finance it, because there are no regulations right now. In Germany, they have the diggers, they have special already made special criteria when you can use which digital tools or which telemedicine. So I hope we will do it quite soon. What we really is unique in Austria is we have a unique documentation system. It's called ELGA, where every patient, the data of the patient is inside and the patient can look inside. And if you want the hospital or the primary doctors. So this was really unique. We were the first one in Europe, but we also have to go fast now with the questions you ask. So how can a patient be sure if he uses something that the insurers will also pay for it? Yeah.
Thank you so much for your answer. And I believe that the students here also have a lot of questions for our speaker today. I see that we have a representative here who has a question for our speaker. Could you please introduce yourself to our audience here?
Thank you for your all very nice talks today. And my name is Pooh. I hope you remember my name from our afternoon trip. So my question goes to Dr. Katharina about your research about the kinetics of single molecules. So I'm very amazed that we can like monitor single molecules like continuously. So what do you think about the future of like measuring continuously the biomarkers like IL-6 in patients? Thank you.
I think it's a big challenge, especially for patient samples. And there are also other techniques out there which actually look at the single molecule itself, because I do like some enhancement on top. So this is kind of my way, but there are great advanced techniques of microscopes or like some plasmonic approaches just to look at each single molecule, which might be also very suitable, but then come at high cost, for example. So there are a lot of options out there. The main challenge is always to implement them into the hospital settings, I would say.
Thank you so much. I hope the answer of Dr. Katharina Schmidt will be very insightful for all of us here. And we are also having a lot of questions online. And I would like to ask the representative of Vietnam here, of the Can Tho University of Medicine and Pharmacy. We are having the question related to the healthcare education. So specifically, what are the key challenges in applying artificial intelligence in the healthcare education, especially in the Vietnam setting?
Thank you. Thank you for your question. Relate to the dental education, relate to AI.
It can be also related to the dental, your specialty, but
Yes.
also your general sharing about the importance, the role of AI and in healthcare education.
Yes. So you can see from my presentation, now AI very important in different kind of treatment in dentistry, especially in the patient how the toothbrush, so orthodontic. So AI very important and relate with to many departments in the university, and important to improve the teaching with the AI in dentistry. The most important that the lecturer need to improve their knowledge and their skill in AI, because now the young student, young student and the young generation, they update the AI very fast. So we are lecturers, so we have the article with the update the information of AI, and we need to learn every day because many update AI program relate to the dental treatment. Yes.
And following up this question, I also have another one regarding to our students here. So what advice would you give to the students who want to turn their academic knowledge into real world impactful innovation? And what advice would you give to also young professionals who want to contribute meaningfully to your field? Yes.
So now I know the young student, the young generation, they were very good in English skill and internet. So this is the best way to improve in dentistry. They need to update every day via the internet for the Google. We can update from many programs by themselves and can interact with other professor and lecturer. And even though they can interact with their friends, yes, to update the knowledge and to improve their skill every day. Yes.
Thank you so much. May I kindly ask, is there any other questions from our audience here today? I see a raising hand from that corner.
My name is Anne. I'm the dentistry student, and I have a question for Dr. Churcher. Do you think the use of AI in healthcare reduce or enhance the empathy in patient care? And what the psychology factors should be prioritized when applying the digital healthcare system? Thank you.
Thank you very much for the question. I'm not sure about did you say how AI can be used for empathizing with others? So for training in communication or do you mean in general how AI?
That I want to know that do you think if the AI can emphasize, can increase or decrease
Empathize. Okay.
yes,
Okay.
the patient problem?
Yeah. So yeah, definitely that is what we are heading to, that this AI solutions help us in the health system. For example, to spare some time, you don't need to do so much documentation when this is done automatically by AI in the background. And you also can think of different solutions here in the background. However, from the psychological perspective and from the implementation perspective, what like to say here is always think these technical solutions from the human factors, from us and end users first. The technical solution should only be a helper. We humans are the ones who are using these solutions in the end. So put the humans in the center in the development. This would be my take-home message here. Thank you very much for the question. Yeah.
Thank you very much, Dr. Gernot Gerge. And is there any other questions from our audience here today? I see a raising hand here.
Good afternoon, everyone. My name is Guang, the first year student in class B1. And yeah, I'm from the Department of Medicine. So at first, it's really my pleasure to be here and listen to all meaningful presentation. Because I'm the first year student, so I don't use AI much in clinical or something like that. I usually use it for my research and the way I study. So I know the term AI hallucination, but actually I don't know exactly what makes the AI's hallucination. So my questions to Professor Georgia is that I usually have the unique way to reduce AI hallucination by using another AI to check the AI hallucination that I currently use. But over time, I think it's not the good way to reduce my hallucination, my current AI hallucinations, or I just making it worse. So yes, it's my question. Thank you.
Thank you very much for this question. A very important question about the hallucination rates in AI and where they are coming from. They are coming from the technique in the background. AI is basically a correlational system, and in science, correlation does not mean causation. So it's built in the system already that you will have a certain amount of this made up informations. However, current systems get better and better in avoiding these hallucinations. In the scribes I presented here, you can get down with the hallucinations to 1%. So you will have basically a 1% error in documentation. You could put it this way. Now the important question for you in the process is like, is this 1% rate of hallucinations then good enough to conduct the process in a safe way, in a patient-safe way, or not? And that's like a different kind of questions. But coming back to initial question, it's in the artificial intelligence technology that artificial intelligence is not using the verbatim information. It's combining information with the highest probability out of the data set that you have in the background. And so there will be always some types of hallucinations in there. And the important take-home message here is we need to shield against these hallucinations when we want to use the systems. So we need to come up with like accepted error rates. For example, we as humans also make errors when we document something. It's not only the AI, yeah. But there we have ways how we deal with it, and we need to come up here with processes for when using AI as well. Thank you.
Thank you so much, Dr. Gernot Gerger. And I believe that for this particular issue about the error and hallucination, I believe that Professor Maria Klechter-Pulka could also share some your insights about this.
Yeah, thank you. Yeah, the liability is the big question. A lot of people are always afraid, even when you're a physician, you're a dentist, to make an error. But now they are also afraid that if I use an AI system and it makes an error and I'm responsible for that. So I think this would be very important for the government to find here a solution that you can work safe, not be afraid of legal consequences or stuff like that.
Yes. And Dr. Katharina Schmidt, what do you think about this issue regarding hallucination or the errors in medical treatment or balancing between the technology, artificials, and particularly your field?
So in my field, we also go in this direction of implementing AI with biosensors, and but it's not that advanced that we could really rely on it, I would say, right now. Yes, I mean, I think you already said a lot about this error that is like who is then responsible and so on. And I think also from the patient side, from the point of view of the patient, it's always very scary, especially also for older people, that AI and new technology is doing the diagnosis for you, and then to have this kind of patient-doctor interaction, I think is also very important.
Yes, thank you so much. And I believe that that's also the importance and significance of the humans, how to use properly the technology and artificial intelligence. So regarding this also very interesting topic, could I please ask Associate Professor Đỗ Thị Thảo also about the errors of technology or artificial intelligence, especially in your field? Have you ever experienced any errors, and you have any information to share with our audience here?
Actually, we can see there are many benefits with the AI when they apply in the dental treatment and treatment planning. And however, we need to know many side effects with we use AI a lot. And especially in the education, we give the homework for our students. They need to do something and they can use the AI to review and their exercise. Or for example, when we do the treatment plan for the patient, something is not correct. So we need to evaluate it very carefully when we receive the result. Yes.
Thank you so much. And is there any other questions from the student? I can see the raising hand from the end of the hall. Kính mời ban tổ chức có thể đưa mic cho bạn sinh viên được không ạ? Could you please introduce yourself to us, please?
Hello, I am Phan Cao Yan of the dental class. I would like to ask about the practical implication of AI and the feasibility of its enforcement. Like, how close are you to implement the law into reality that everyone will keep it in mind when they practice medical? And I would like to ask Ms. Thao, not about our school, about our physician phone number, but about Vietnam closeness to that process.
So I think this question, let me firstly ask Professor Maria Kletter-Pulker regarding this question.
Yeah, the first steps were made already by the European Union, the AI Act. So we have to implement it now in the Austrian law. We have some time, some months left. And as we started already, we made some changes in the healthcare professional law, like for the physicians, for the dentists, to say you're allowed to use telemedicine. The next step would be, how are you allowed to use AI? But I think it's also the recommendation for the hospitals and the health insurance. Do they finance it? And how do you act just if there are any mistakes? So I think there's a lot to do. And I'm part of we have a special council who is for the chancellor, for the Austrian chancellor. There's a big council for experts. And this is also part of our experts, just to discuss what would be important to make the regulation. And as we said, the most important thing is the human being. And as you said in the beginning, it's the humanity and the ethics. And so how can we protect the humanity within coming all the AI, and which regulations do we need to protect humanity, which is so important just also for the treatment of the patients, because we know that certainly is very important if there is a personal contact. So this is what we have to discuss right now and have all the projects and just to see how people react, which protection law do we need. So we are just right in the stage and process we are going on.
Thank you so much. And I believe that Associate Professor Đỗ Thị Thảo, maybe, is there anything you can add? Thank you so much. And is there, I can see the audience here. Could you please introduce yourself to us?
My name is Tamang, and I'm currently a second year dental student. Thank you for your presentations, and I have a question that will the new technologies, especially AI, make dental care more expensive for the patients, or can they actually help lower the cost of the treatment in the long run?
I think it's about the dental issue. So may I ask Associate Professor Đỗ Thị Thảo to answer this question?
Yes, you know, in the dental treatment, we use the AI application in different kind of dental problem. For example, in orthodontic or the implant or the prosthodontic. And with this modern facility, it means that the price for the treatment is quite increase a little bit. So maybe the patient need to pay more compared with the traditional method for every treatment. But if the patient can adapt or agree with the fee, the treatment is more accuracy and more faster, quick for the patient, and maybe the quality is more better. So that's why when we use the AI for the dental treatment, we need to use many equipment and facility. For example, oral
oral scanner, intraoral scanner to make the imaging, and we can do the visual planning with the AI. And with the visual planning, we can give the denture or the products with high quality, and it's very fast. Maybe some treatment before we have the AI, we need some week or some day to get the products. But with the AI, we can do only one day or the half of day can got the result. Yes. So the patient feel more comfortable and more happy with a new denture, or they have the new clear aligner for the orthodontic. So the patient can sell that home. Yes. And they feel more comfortable and more happy with the result. So that's why the fee for the treatment may be higher than in conventional or traditional method.
Yes, thank you so much. Because we are speaking of the fee that the patient has to pay. Associate Professor Đỗ Thị Thảo just shared her information in regarding the Vietnam setting. So maybe I think Dr. Katharina Schmidt, could you please also share about maybe is there any regarding the fee about the patient has to pay in your own field, especially in the European healthcare system? Because I believe that there are also differences in the healthcare system between Vietnam and European Union. So could you please share with us the role of AI, the technology, and is there benefits or disadvantages when it comes to the cost for the patient?
I'm not sure I'm the best expert to ask here because, again, I'm not in AI. But for biosensors technology, I would say it should reduce the cost for diagnosis in the long run. That's for sure. Because as I said before, it should be a point of care device, so a small device which should be cheap and disposable afterwards in the best case. So it should reduce the cost. And probably in combination with AI, this is like where the direction goes to. It will be even an improved technology.
Yes, and Dr. Gernot Gerge, what do you think about this?
No, actually, it's a very wide question because it's relating to very different aspects in the treatment process. The promise of AI is that we will have a gain in efficiency via this technique. And now the question is like, how this efficient gains then translate in monetarization and so on. So it's an economic question. For me personally, for example, I'm a basic scientist. For me, my main focus is not the monetarization, but rather how can we use this technique in a patient and employer safe way? That's my main focus here. And in the background, that's an economic and societal questions like who will cover the costs for it and how.
I think what you said is very important, and I think it's the law, because from the side of the law, you have to see that every patient gets the best treatment, the best we can afford. And I think right now, implementing and research, it costs, of course, more money. But at the end, it should reduce cost, it should reduce time, so the patient comes quick to a treatment. And right now in Austria, we have the problem, as I said before, we have 9 provinces, 9 different parts in Austria. We have a different finance from the hospital, from the primary care. And I think we lose a lot of money because we have different ways like the money goes. And I think it would be also a change, just we make only one way, like the money goes along the patient path. And so that we can use the money in the best way. And we have to see that all the patient, doesn't matter which education, doesn't matter how much money he has, that he gets the best way of treatment. Maybe with AI, we'll see where's the AI better or not. So this will be also part of the regulation to see what framework do we use to make to use the AI.
Thank you so much. And I think now we are waiting for the very final questions from you. Is there any other question? I can see from the right corner.
Câu hỏi của em là Mọi người nghĩ là cái việc mà phẫu thuật và chuyển đầu của người này với người khác để trị một số bệnh như là người thực vật hoặc là ung thư hoặc là chết não có khả thi về mặt kỹ thuật và đạo đức hay không?
Well, this is a very interesting example. But as you said, in future time, more things will be possible. And this is always, we have to discuss from an ethical view, but we also have discussed from a legal view. And since research allow more things, there are always new interesting way of treatment we have to discuss. And it's always the law and the ethics. Usually the law is always behind. First, there are new things that just try to make new treatments. And then afterwards, we have to say from the legal view, we have to change it. Like, for example, when we came here yesterday, the highest court in Austria said, because in Austria, it's not allowed to make social egg freezing. I don't know how is the legal situation here in Vietnam, but the highest court says it's not okay that we don't allow social egg freezing. So we now have a change in the regulation that everybody, young women especially, can just make social egg freezing. And it's the same in all other fields of research and all fields of the use of AI or treatments.
Thank you so much. And one more question. I can see in the right corner. Could you please introduce yourself to us?
Hello, everyone. I'm currently a dental student. And thanks a lot with your amazing presentation and useful information. And I have a curious about telehealth. I see telehealth as a good method in the future, but how we can spread out this telehealth to everyone in the communities, because it depends a lot factors that can affect their citizenship practice. Maybe the foundations, the knowledge, the internet, maybe even so. And I have one more curious about AI empowers. With me, as our young researchers and young students, how we can use AIs in our research activities in a good way that can make this as a good tools for us. And maybe it's about our studying. Thanks a lot.
So thanks a lot for the first thing. I think it's very important. As I said, I think everybody has the chance to use telemedicine. And of course, there may be some people that are not empowered because they don't have a smartphone. They are not able to use it. I think it doesn't depend on the age, because my father is 93 right now. He's using his smartphone, is having his tablets and everything. But this is also a special research topic of us, because we're looking on the analog patients. Because the question is, how can we afford that the people that are not able to use telemedicine, not able to use the digital tools, how can they also get the same treatment in the quality? And this is now a new vulnerable group we also have to look at. I think it's a very interesting aspect. I think maybe you can.
To telehealth. Sorry, now with telehealth, I completely agree here. Not have much to add. With regard to learning with AI tools, there are so many different possibilities in how you can actually use AI efficiently during your learning. For example, I sometimes even use it for idea generation and things like this. However, when it comes down to the essence of science, to writing things, to thinking about things, there I would recommend use your brain before you use AI.
Yes, so thank you so much, professors, for sharing this very useful information. And now we are coming to the end of the part of the Q&A. I think there is another question from the student. Could you please stand up and introduce yourself to us?
Hello, I'm Như Ý, and I'm a dental student, and it's a great honor for me to be here today. And I have a question. I think this is the final question today, right? My question is, what kind of training or collaboration do dentists need to effectively use biosensor technologies in practice? Thank you.
Thank you for your question. So from my presentation, you can see that biosensor or intra-biosensor. Recently, the new technique or method we can apply in the diagnosis and treatment in different kind of oral disease or any orophacial problem. So I think that's this is the new technique and new idea that I know when I review this presentation today. So I think in the future we should have more research, or we need to know and try to understand more and more this to you in the dental application treatment. And I think for the detail of biosensor, we should have the idea from Dr. Katerina. Yes.
Thank you for the question. I think I'm not in the dentistry area right now, but I think it's a great area to explore, which I hope will be part of this collaboration which will come out of this. So, thank you.
Thank you so much. And I believe we are coming to the end of today's discussion. Our InnovaConnect event today is about the future of healthcare, and we are here with a lot of future generation of the healthcare of Vietnam and maybe the global healthcare. So we are having a lot of talented students, talented professionals. So I believe that all of us here are very looking forward to hearing maybe one message, one advice from each of you to inspire them to pursue their career. So
Thanks a lot. I think you have to trust in you. Just follow your ideas, and I think you have the idea to make the world better and to help the patients and to make a safe treatment, but also always look on yourself, because this is also a guarantee that you can do your best for the patients.
I completely agree. Trust yourself, trust your brains. Our brains have developed our evolution. They are good. Use them with the help of technique in the background.
So my advice would be to not always follow the beaten path, but to find your own. So there are a lot of options, especially for combinations. Like even if you're just in one study right now, you can always look to combine stuff and be more interdisciplinary, which is, I think, a great field to be in.
And Professor Thao.
So you can see after you listen the presentation at this conference, you can understand more about the telehealth safety and the safety patient and the AI and relationship between the dental with the biomedical engineering. One part is the AI and biosensor. So I hope that in the future we should have more collaboration and research about the AI and biosensor and telehealth in dentistry. Yes, thank you.
Thank you so much. And with that, we have come to the conclusion of today's InnovaConnect event. On behalf of the VinFuture Foundation and the Can Tho University of Medicine and Pharmacy, we would like to express our heartfelt gratitude to all our speakers, Professor Maria Clara Pucher, Dr. Gernot Gerger, Dr. Katharina Schmidt, and Associate Professor Do Thị Thao for sharing such insightful perspectives. And we also would like to extend our sincere thanks to both online and people here joining us in Can Tho for your engagement and participation. And before we close, a quick reminder, the nomination for the 2026 VinFuture Prize are now open. And we invite you all to contribute to recognizing breakthroughs, innovations that improve daily lives. And for further information on how to nominate for the 2026 VinFuture Prize, please visit our website at www.vinfutureprize.org. And before we close the event, we would like you to all scan the QR code showing on the screen for the post-test. So could you please scan the QR code for the post-test, please? Thank you so much. And once again, thank you all for joining us today. We look forward to seeing you in our next InnovaConnect session. We wish you a good rest of the day.
Cảm ơn mọi người đã đến và tham dự InnovaConnect. Xin một tràng vỗ tay để chúng ta kết thúc cái buổi InnovaConnect hôm nay ạ.